in the sector in relation to student drug and alcohol use every year. It's always really, really nice to bring people together and have this conversation. And to just give you a little bit of, info and background on us from the SOS Wellbeing team. We lead a lot of work on student drugs and alcohol, specifically looking at higher education institutions, and also looking at some further education institutions as well. So our main focus is to support universities, students' unions and students to think about how they approach drugs and alcohol on campus, and we do this through a range of different programmes and activity. So every year we host our annual survey, which some of you may have seen, and we'll touch on a little bit when we talk about the research. We also host an awareness week every year to, bring this engagement and activity onto your campuses. We host an annual conference yearly to bring together experts, not just in higher education on this issue, but across the kind of health sector and the charity sector as well. And we also deliver training. We deliver that online and on campus, and we have our kind of core programs as well. So we deliver Drug and Alcohol Impact, which is a framework-based approach that looks at supporting universities and students' unions to work in partnership to move towards harm reduction, and our Drink Rethink programme, which is a really wonderful peer-led initiative where we train students to have brief intervention conversations with their peers to look at their alcohol use and to encourage kind of consideration of that. If you're interested in those, we will send some links out after so you can get a bit more info, but I don't want to spend too much time talking about that. So just as a quick overview of the session, we're going to be looking at a quick snapshot of the research. As I said, this will be based on our annual survey data. We're going to look at the national picture of harm reduction in higher education at the moment. We're going to look at some new legal opinion that's been published and kind of talk a little bit about some of the legal risks that are highlighted in that. And we'll think about a few practical next steps for delivering this work on campus before we end. We'll have some time for questions, depends on how much I chat. So please do drop those in the chat or the Q&A box and we will get to those. Right, so to get us started, hopefully people have a mobile device or a laptop in front of them, however you're joining on this. We're going to be using Slido just on and off throughout this. So if everybody would be able to log in and join so you can answer these questions. I'm just going to keep this up on here for a minute. Sometimes people have issues with Slido and they struggle to get into the platform, or you don't have a device that's working with it. If you have any of those issues, please feel free to just pop your responses in the chat if you want to. The Slido is set up to be anonymous, so your responses won't be kind of allocated to your names. Obviously, if you post in the chat, it likely will be because of your Teams account. Fiona, would you be able to just copy that code into the chat if you haven't, just so that I can move on to the next slide shortly? Obviously, please do feel free to use that QR code as well. I'm useless with them and can never get them to work though. We'll go through a couple of little quick questions now, but please do keep the tab open on whatever device you're using, as we will kind of revisit this as we go through some of the topics today. Okay, I'm hoping that that's been enough time. So our first question here is just thinking about you personally as an individual. How confident are you currently in your understanding of harm reduction on campus? And I will let you guys start doing that. I haven't set it to automatically show you the responses, which is why if you're used to Slido and it normally kind of immediately jumps when people are on there, that's why it's not doing that. We'll look at it on the next slide. I didn't want to impact anyone's responses by kind of seeing everybody saying they're either super confident or know nothing. Wanted to get your real reflections on this. You can see we've got 26 people on there already. There's quite a few people who are on the call who may not have accessed Slido yet. So if it's not working for you, please do feel free to just drop responses in the chat. This is a scale of 1 to 5 of, very little confidence to very confident. Okay, I'm going to move on to the responses that we've had just to give me a bit of an insight into who's in the room. Amazing. So that kind of 5 is that very confident end. So we do have a real mix. Some people are very confident, which I love to see. But with the majority of people in the room kind of being in that middle 3 to 4 section, which is great. Please don't worry if you feel like you are not confident at all. This is, there's a lot of work happening in this sector. And it is all really new, and it's why we do sessions like today, so that we can kind of highlight some of those resources that you might find helpful. And we will also send out some resources for you to engage with following this as well. So just quickly, one more question. I wanted to just grab a quick snapshot of what brings you in today. So on your devices where you've got Slido open, this should have moved on to the next one. It's an open text response. Obviously, I can't guarantee that we are going to achieve any or all of these in this session, but it's really helpful for me to have in mind. I can, adjust some of what I say to make sure it's helpful for everybody in the room. But also, if we can't help you with those specific issues today, we'll be sending out those resources, as I said, and you're also more than welcome to get in touch with us to kind of have a separate conversation about your specific situations, what's happening on campus, what you want to be working on, what barriers you may be facing. So I'll just give you a quick minute to fill that in. And yeah, as I said, at the end of this session, there is a little form. It's another QR code actually that you're able to fill in to just request a bit more support and advice from us as well. I can see we've got 13 people on this one now. I'm wondering if people were on the last one and I jumped on too quickly. We've got some responses coming through. Again, I've got the answers on the next slide because I want to get people's real opinions and not have them be influenced by anybody else's responses. I'm aware of time, so I'm just going to jump us on. So we've got some people not sure. Some people not sure, kind of changes in the work being consistent on campus, just wanting that overview, wanting to look at partnerships with Barrett, who I think is a local drug and alcohol charity, who provide that support services, some of that current context. Well, hopefully a few of these things we can do. We are going to go through a bit of a brief context. There's so much more we could talk about. So please do, read those resources when we send them out. Absolutely fine for those who are not sure. I'm just glad you showed up. So I'm going to move on, but I will revisit that afterwards just to see if there's anything else we can do to support some of those responses. But I just wanted to start us off today with a really brief snapshot to contextualize some of today's conversations. I think especially for those people who said, I'm not necessarily the most confident in this area, and I'm also not really sure why I'm here, but I am. This research on student drug use comes from our annual student drug and alcohol survey, which takes place in November every year. Last year's survey had a total of 11,894 responses from students across higher education in the UK. So the next few slides, that's where this data comes from. That's the kind of student population who responded. And this is, shared by promotion of the survey on campuses by local partners, which we can absolutely help you to do this year. It's completely free to get involved, and we love seeing people get involved with this. But this is just really helpful for us when we're considering the why of this work. I asked you what you're hoping to learn. Some of you said you didn't know. Maybe understanding some of these whys behind why we do this will help. So, as I said, the survey does look at drugs and alcohol, but I've just got a few quick highlights from the drug side of that. So we do break that down into student drug use and student alcohol use because there's different behaviours, and also because we ask students about their behaviours in relation to if it's an activity they do. So one of the main questions people ask us is, how many students are using drugs? And we're never going to have an exact number, I think. We cannot survey every single student, but this survey shows quite consistent results across other research that looks at young people drug use as well. So in the survey from the last year, we had 20% of students currently using drugs, 27% who had used drugs whilst being at university. 7% of those are people who have stopped since being at university. And then we also have the 79% of students who do not currently use drugs, 62 of those having never used drugs. So when we think about HE and the 2.9 million students we have in higher education, if 27% of those students are potentially using drugs while at university, either they may have used since they started and then stopped, that number equates to 783,000 students who have used drugs while at university, which is quite the significant chunk, I would say. And I'm really grateful to my colleagues who did the maths on that for me, because I would not have considered doing that, and I'm still shocked by that number. So that 783,000 students that we are talking about here, that's why we're doing this work. We have the ability to, make change, keep them safe. We also talk about the motivations for drug use. I'm not going to go into this in loads of detail, but what we will do is send you over the full report and the last couple of years' reports. They're all hosted on our website, so you can look at this yourself. But I just wanted to highlight that, the motivations for student drug use really vary. Recreation obviously being the most cited reason here, but we also see a lot of things that, potentially relate to mental health, physical health, and self-medication. We've got dealing with stress quite high up on that list, with 18% of students who use drugs saying that they have used drugs to deal with stress. And this data that's on this slide here is from specifically the students who said they have used drugs as a student. So that's why that kind of weighted base number at the bottom is smaller. So this includes students who have since stopped using drugs while at university. We also see different reasons behind student drug use for different groups. You'll see some of those on the right-hand side of the screen in the blue boxes. So we do look at, the different kind of demographics within the student population as well. And just quickly, the other question people always want to know is, what drugs are people using at university? This is a very shortened version of the list. If you want to look at the full list, it is much more varied than this, but these are the kind of top substances that came up in the last survey. And we ask students not just if they use them, but we also ask them about how regularly they use those specific drugs. This is really helpful for campuses, because I think a lot of that harm reduction advice that we're going to talk about providing for students, it needs to be specific to what's happening in your student body. So this allows us to tailor that to be really specific. So that's a really quick snapshot on the data on student drug use, a little bit of the why. It's a huge amount of students. We're seeing behaviours that are potentially quite risky on some of these, and we want to be able to respond to that in a way that responds to not just the drug use, but also understanding those motivations. So this ties in really well with any work on belonging on campus. It ties in well with your mental health work, anything to do with disability as well. So we would really recommend you guys look into that. And then I just want to move us on to the national picture. So we only have an hour today. It would easily take us the entire hour to do a really deep history of this work. A lot has been happening in this space, but we are just going to focus on kind of what's happened in the last year or so. A lot of work has happened previously. We've been doing this work for a really long time before that, but I want to focus on the kind of current picture. Again, some of this is really helpful for getting to know that why are we doing this? Why are we doing this now? So one thing that happened in the last year, June, July last year, was the publication of the Universities UK sector guidance for dealing with student drug use. So this report, called Enabling Student Health and Success, came out in July 2024, just before the election. This was a really large piece of work that spanned over 2 years from Universities UK, with a UK-wide task force who had the aim to basically provide recommendations and a framework for students in UK higher education institutions in relation to their drug use. This was chaired by Nick Beach, who is the Vice-Chancellor at Salford, was at Middlesex at the time, and was really kind of key in driving this forwards. But the task force also had a range of other experts on there. There was representatives from government departments, different sector agencies, accommodation, public health, charities, policing. There was also a student advisory panel, which was heavily involved, which I chaired. And there was also 3 special advisors to this project as well. So that was Dame Carol Black, who completed the Black Review looking at kind of substance use services in the UK and what that looks like. Dr. Ed Day, who is based at the University of Birmingham and is also the National Recovery Champion, and Owen Bowden-Jones, who chairs the Advisory Council for the Misuse of Drugs. So this was a really far-reaching and really expert-led piece of work. There's so much that went into it. I don't have time to go into the details, but there was data collection, a lot of research kind of backing this up, as well as really intensive considerations. But the main thing to know from this today is this one very simple statement. Universities UK recommend that universities adopt a harm reduction approach to drug use. So you may have seen this guidance when it came out. You may have potentially come to our webinar last year about this guidance and implementing it, or you may have never seen this before and just kind of be new to this. So it recommends a harm reduction approach to drug use, and that kind of looks at not condoning or condemning drug use, and it doesn't seek to normalize the use of drugs either, but instead it aims to minimize the harms which may occur for individual students if they choose to take drugs, and it does that by focusing on health, well-being and student support, whilst also providing really good information, advice and guidance. There was a lot that came out of this report, but I just want to highlight this piece around the kind of policy change here. So traditionally, universities have a zero tolerance approach. We are seeing a very significant move away from that now. But one of the things that this report does mention, one of the research pieces was a student survey. And we see students who were seeking support reporting that they were fearing the consequences of negative outcomes because of that zero tolerance policy when asking for support. And they also stated that the provider's policy was actually a barrier to them engaging in that support to begin with. This is so important. We want to be increasing student confidence and trust in asking for help if they need it. So the UK survey data found that zero tolerance did not decrease prevalence of use, but it deterred students from coming forwards. This was then echoed at roundtables with higher education providers and students. And this was something that kind of came up in a lot of conversations at the time, that there was a really big worry that this would be too difficult to make change on campus, that perception and that trust especially. So it's a question that we ask in our survey as well, and we've been tracking for a number of years. But a lot of people asked, how can a university make a student comfortable enough and have enough faith in them to seek support on such a sensitive issue? So I just wanted to highlight, I mentioned our drug and alcohol impact programme. So one of the things that kind of is part of that is a student-led audit. So we get institutions to complete a lot of activity and engage with a lot of ideas around student drug and alcohol use, and then they kind of report back on how that's going, and it's their students who do that audit, which is always really fun to get students involved. But on that point of being this is potentially too difficult, this is potentially too much work, I just wanted to show some of these stats showing we've seen a 62% reduction in students who fear judgment from their university when seeking support on one campus. We've seen a 37% increase in students who said that they would access drug advice from their students' union on another campus. And then the other part, I think that, that risk of normalizing drug taking, which often comes up as a concern, we've also seen really clear reductions there on some campuses in relation to students saying that drug taking is or isn't a part of university culture. This shows that it is really possible to do this work and to change these opinions from students. It has to be well done and it has to be consistent. But the partnerships that we work with, so with universities and students' unions working together, have been really successful in this by delivering kind of cross-campus activities in terms of policy, support, comms, engaging with students and doing co-production. We don't have the time to go into every single win that they've all had, but I could honestly do that for days. So if you want some examples of work that's led to these kind of impact stats, do just get in touch. And just one more thing, in this small section looking at the current context. So 1 in 8 universities retain zero tolerance drug policies, and a year on from guidance on wonky. These headlines have come out recently, and they may be headlines that you've seen in terms of, being part of the higher education sector. And this focused on work done by a charity called SafeCourse. SafeCourse was founded by Hilton Mervis following the tragic death of his son Daniel by drug overdose in 2019, whilst he was a student. And one of the quite significant things that came out of the end of that kind of tragic situation was the coroner finding that the adoption of a zero tolerance approach by the college at his university may have prevented him from seeking that help. So just what we were saying a few slides ago about that kind of discouraging people to seek support when needed. So Hilton Mervis then set up SafeCourse, and one of the pieces of work that they've done follows the publication of the Universities UK guidance, and SafeCourse sent FOI, so Freedom of Information requests, to 144 universities, and they found quite significant inconsistencies across the sector. There's very much a chance that some of you in this room were potentially the people who had to fill these out. So sorry if you were, because I'm just going to ask you the same question, but with an added unsure option for you. I just wanted to get an anonymous snapshot of the room. So if we can grab Slido again and just look quickly at, is your institution adopting a harm reduction approach to student drug use? We've got a few options: yes, in progress, and no. I'm not going to stay on this too long. It's just a helpful snapshot for me going into the next section. And I'm also really aware that I've already talked for longer than I planned. So looking at those responses, this mirrors, I think, quite a lot of the findings, with 38% kind of being in progress. I'm really interested in this unsure category, because that's quite a good chunk of you in the room. Please do let us help you figure that out, because in a dream world, everybody on each campus would know what that approach is. That's absolutely essential to this being consistent. So if you are in that unsure group, please do, feel free to mention that to us and we can have a chat. But this is kind of, a good snapshot. So we've got a lot of people who are in progress, slightly less people who have got a harm reduction approach at the moment, and then a few who don't. My assumption would be that those who say no are probably operating on a maintained zero tolerance approach from previously, but that may also be incorrect, but they tend to be the two camps of this work. So out of the back of those Freedom of Information requests, SafeCourse found that at the moment, of those 144 universities who received Freedom of Information requests, of those who responded, 34% have already adopted a harm reduction policy, 33% are developing those policies, and 13% are maintaining those zero tolerance approaches. So kind of similar-ish stats to what we got, obviously missing the unsure category, because I think for an FOI, people have to find out. But it's really interesting to know that people in the room may not know those approaches as well. So not to jump to practical next steps at the end, but absolutely please do some work to figure out what that approach is on campus, and we can help you with that. So what this shows is that we have a really inconsistent approach to this at the moment. Despite the UK guidance in the year since, we aren't at a point where the majority have completed their work on this. And we also see some universities who haven't started working on this. So there's a lot to be kind of considered here. But I just want to move us on to talking about the legal opinion. So this came out around at the same time as the Freedom of Information requests and the kind of media stories that I mentioned a minute ago. So in addition to those Freedom of Information requests, SafeCourse released legal opinion, which was commissioned by them, but authored by Victoria Wakefield KC and Tim Johnson of Brick Court Chambers. And they've made this publicly available. So this is online on the Safe Course website, and we will also send out the links and information for you. This guidance kind of highlights some of the potential legal risks that universities could face in relation to student drug use. But it's really clear, and I want to make it clear here as well, that this was an opinion provided for Safe Course. This isn't kind of sector-wide guidance and kind of gospel for you all in the room. This is not legal advice that was provided for you or your organisation. And also, we are not legal professionals. I'm not legally qualified, so this is not legal advice for those on the call or for the institutions that you represent. But at SOS UK, we want to make sure that we are highlighting information that can support you in delivering work on campus to support students. And in this case, we're sharing the information that's provided in the legal opinion by the previously mentioned legal professionals, just to kind of give you an insight to that and to maybe start some of those conversations. We won't be able to answer any questions that are kind of rooted in the, the legal framework or the legal risks or outcomes really, but we will be able to talk about some of the best practice and examples that we've seen on campuses. The opinion, again, or the authors of the opinion are very clear in noting that this is not and should not be understood as advice to any party other than Safe Course and should not be relied on by third parties. And they do recommend, if you, for some reason, felt the need to receive your own legal advice. And we'll talk a little bit about, what that could look like if it's needed. But this is quite a dense section. So the guidance is publicly available. This opinion is out there for you to find, and we will send it to you. So please don't try to take super detailed notes. It is very dense, and I'm going to try and move quite quickly. So I just first wanted to note that I've taken these slightly out of order. So if you are someone who's Googled it and got the PDF in front of you, this may not look exactly the same. And I've also paraphrased these to make them more concise for the purpose of fitting on the slides. So don't be confused if it doesn't match it if you're looking kind of at what's in front of you. It's also helpful for us to note that the authors of this piece of work, this opinion, highlight two types of claimants that were identified in the legal opinion, which was students who use drugs themselves and also students or staff who do not use drugs but sustain damage from a student who does. So we'll mention kind of the claims here, but those are the potential claimants that they highlighted as seeing, as finding as possible. So we'll go through the 5 legal risks that they outline in this opinion and that Safe Course kind of highlight in the introduction summary. And we'll look a little bit into what this means, how institutions could respond based on some of the opinion as written. But again, feel free to post questions. I'm likely to be unable to answer specific legal questions, but we can come back to those. And there may be some best practice examples we could share instead. So this first section here looks at negligence claims. So this is kind of one of the main focuses as conversations kind of about duty of care, I think, have been ongoing in the higher education sector for a while now. I'm sure if you work in student wellbeing or mental health, you are well aware of some of the conversations that have been happening around this. The authors of this report felt that negligence claims were the primary form of potential liability here for universities. And as you may know, again, from that similar work, duty of care would first need to be kind of proved in any instance with this sort of claim. And this would be related specifically to policies on your institution, your campus. And so the opinion does not go into specifics about what this could look like for individual campuses, but it does give kind of a general overview. And then the second point on contractual claims, this looks at your commitment as a university to your students and what is in those written agreements that you hold with them. So the authors found that this would potentially include things like your policies, but also other areas as well. So the authors state that there are, a number of civil claims which have been brought against universities, including contract claims, not specifically in this area. And this is explored in slightly less detail, again, because it would be specific to each institution, and also the contractual agreements that you have in place. But the authors flag a couple of potential areas that need to be kind of considered or could relate to claims, as being students who use drugs, so that first type of claimant, and pastoral care and support for that student. And that relates to not just the provision of that, but also the potential lack of or the lack of access to. And also then going back to those third-party claimants, this contractual claim, for example, the authors highlight it could be in relation to disciplinary policies. So somebody who has been injured, potentially saying your disciplinary policy is inadequate in that it didn't stop the harm happening, or failure to enforce this policy, exposing that individual to harm. And then finally, the authors also mention more general claims to be providing a safe environment for students here. And I just want to go back to something I don't think I said on the first page. I think it may be in my notes a little bit further on, but the overarching viewpoint that is shared by the authors of this legal opinion, they do mention that they feel like the risk of any claims here are low. I was meant to start with that because I know it can be quite scary, looking at legal risks and what this means for you and your institution. So we'll touch back on this, but this is really helpful to just remember this is not something that's happening. This is quite hypothetical in the opinion, and the authors do say that themselves. Without a specific case, it's hard to provide an opinion, and also they feel that this is unlikely to happen, but not impossible. So those are the two types of claims. I am not necessarily the best person to have given that detail in the time I have. But I just wanted to flag a few more of those risks they identified. So policy incoherence is flagged as a legal risk by the authors and by SafeCourse, regardless of the approach that you are taking on your campus. If this is written into your policy and that is not consistently followed or put into practice, this could be increasing your legal exposure as a result. So we're not only, talking here about whether you have a harm reduction or a zero tolerance policy, but what you actually do on campus. So there's a lot to think about under that. The authors also noted that the UUK guidance would be seen as sector best practice. So if there were any claims brought, it is very likely that that would be seen as best practice. So one of the mitigations that they kind of mention, in terms of making yourself less at risk, would be to be able to demonstrate that you have implemented this, and that you are kind of following that best practice policy. So the Universities UK guidance is not mandatory for institutions to follow. It is guidance, but it is now identified in this legal opinion as best practice. And the ideal there would, I guess, be compliance. So you can demonstrate that. I'm really aware that this is a weird session to be doing without any feedback. So I'm hoping that everybody's not like yawning and looking very bored. This final legal risk that was identified in the opinion, I just wanted to highlight on a separate slide. This is not only embedded in this legal opinion, but it's also the story behind the founding of the organisation who commissioned this work. So as I mentioned, SafeCourse was set up by Hilton Mervis following the death of his son. And just as a reminder that we're all working towards making students safe, in amongst this conversation on potential legal risks identified in this opinion, I feel the need for us to just take a moment to remember that the potential human risks of inaction and inconsistency here too. This is listed as a legal risk because findings from a coroner kind of constitute a legal risk. It's a legal process. And in at least one case in the UK, an inquest following the death has then led to a coroner sending a report to reduce future deaths to a university. What this means is that the coroner felt that the university could have done more to prevent this and should take action to prevent future deaths. I think you can find this online, and it specifically says from the coroner, I believe you and or your organisation have the power to take such action. So this is an interesting point to note. This is a written report. As it mentions on the screen, this is something that gets sent to the university. In this case, it specifically mentioned conflict in approaches in policy. So a policy that specifically says we are very strictly enforcing zero tolerance, and also we encourage you to seek support was the conflict that was flagged there. And it also went a little bit further with the coroner specifically saying that this is likely to have discouraged the individual seeking support whilst at university. The legal opinion doesn't go into detail on some of the other risks that this obviously holds, but I just wanted to mention them. They do mention them in there as well. This is a written report. It's a letter that's sent to a university, which very much can be made public by the coroner. And institutions also have that legal obligation to respond within 56 days. So that's that kind of legal risk there coming through. But that response may also be made public. So often when we talk about concerns in this area, universities flag reputational risk. This would absolutely fall under that category. If they are made public, which they very much are allowed to be, it's also possible that this may receive media attention. So although the legal opinion flags this in relation to their legal risks, they also flag it in relation to, that reputational and media risk as well. So I just wanted to end on that bit. I'm running a little bit behind, but I'm aware that was a lot of info. So thinking back to those risks that we've just outlined, there are a few things that the opinion states that we've got on the screen here. But the authors go on to explore those risks in relation to harm reduction and zero tolerance comparatively. This isn't kind of structured in the same way that this presentation is. But the first point here refers to that risk of negligence claims in relation to being found to have a duty of care. The authors found that those who have adopted a harm reduction policy could be seen to be more likely to have assumed that duty of care by having that policy when compared with a zero tolerance policy. However, the author's comparison here also hinges on zero tolerance responses being viewed as less likely to involve the assumption of this responsibility, which is a direct quote from them. However, as already mentioned, in other sections of this, the authors also state that it was unlikely to solely be focused on one individual policy, like your drug policy, if any of these claims did come to fruition. And this would much more likely look more widely at all commitments made by an institution. So there is a note underneath this section in the author's words that zero tolerance responses don't necessarily reduce this for you, because your whole campus approach would be looked at. Also mentioned in both the legal opinion and in those UK findings, zero tolerance in policy isn't necessarily zero tolerance in practice, which also leads to that kind of policy incoherence risk playing in here as well. And on these second and third points on my screen, looking at harm reduction policies likely leading to a reduction of risk of contractual claims, and also a reduction in the risk in relation to those kind of coronial notices that we mentioned previously. We see the authors stating that harm reduction would likely reduce these risks. And they state that both of these areas potentially consider the role that pastoral care plays at an institution, with UK guidance being best practice again, so that importance of showing that that's been implemented, and that was referenced specifically in relation to those contractual claims, and the potential discouragement of seeking support as a result of those zero tolerance policies, obviously, as we just talked about, mentioned in that coronial finding. So that pastoral and support piece is a large piece of this as well. This doesn't, end with a harm reduction policy. So just trying to neatly wrap this up a little bit. We come to just thinking about some of those institutions who the authors deemed may be at legal risk, but also thinking about those groupings that the Safe Course Freedom of Information requests highlighted. What the legal opinion doesn't do is confirm, specific. It is a general legal opinion of the higher education sector, and it is a snapshot of this moment in time. But we see references made by the authors that zero tolerance approaches may increase risk in specific areas and specific types of claims. We also see the risk that is kind of provided if you are only changing policy. So this second and third one here, there is, repeated mention of UK guidance and implementing those recommendations from that framework as best practice. So if you are not necessarily doing that, there is also a risk there, because that would be seen as best practice guidance for the sector. And although not mandatory from the UK, it would go towards supporting you in this, not just in this section, I think just in general. It's a really good report. I'm going to try and rush through. The legal opinion doesn't have a section that looks at mitigating the risks. So what I have done here is compile a few of the bits that they mention and pulled them together in one slide, but they don't specifically say do all of these and you will be, legally protected. But this is looking at how they've broken some of those specific risks and claim types down. As we mentioned, there is that kind of overarching shift to a harm reduction approach and policy on student drug use that's recommended kind of by Safe Course. It's in the summary in the introduction. Ensuring compliance with that best practice framework, not just in relation to your policy, but looking at your student support, etc. Focusing on consistency and coherence in policy and practice across your institution. So in the Drug and Alcohol Impact Programme, we work with universities and students' unions to do just this, because we want, campus-wide change, not pockets of good practice. And also making sure that pastoral support is meeting the needs of your students, that it's also accessible, whether that's the physical location or the policy not blocking that and causing fear, but also that that's communicated to students. That was a lot of me talking, but I just want to quickly summarise. This is really new in terms of the legal opinion. This is the first thing like this that has been published. There is the potential that more responses that explore this area will come out in the future. So please do keep in touch with us for updates on that. And the team behind this legal opinion, they did find that the risks of legal action being taken were very low, stating that we are not aware of any instance in this jurisdiction where a university has been found to be negligent in relation to harm suffered by a student or other individual as a consequence of drug use. However, they did deem it as possible, however unlikely, which is why we're talking about it today. That legal risk is not only determined at a national level. Multiple times throughout the legal opinion, the authors kind of point to activity and policy at an institutional level influencing that level of risk as well. That all sounds really scary. I think it was scary for me to talk about it. I think what's really important here is for us to all remember that this isn't legal advice provided to you or your institution. This is a snapshot of the sector. And it's not necessarily saying, this or that needs to happen or will happen. But why we think it's important to flag this, especially for maybe some of the Students' Union colleagues in the room or student leaders, a lot of people who are on this call may be really keen to do this work, but facing barriers. This is a useful piece to understand if you're trying to sway senior leaders. It's kind of more typically assumed that harm reduction policies would create a new risk for universities. But this opinion just really demonstrates that there can be more risk if you do not adopt harm reduction. It used to be that there was only a few campuses doing this work, but now there is, that risk of being left behind. So we hope that you don't feel like that was scary. We hope that you find it as a tool that you can use to kind of do some of that advocacy work on campus. And I just want to end this section really quickly with a really quick quote from John, who was the UUK policy lead and also is involved in SafeCourse. Just to remind you, everything I just said, the legal side may sound really scary, and I'm hoping that that's not your takeaway. I'm hoping your takeaway is that, you know, there are so many reasons to be doing this work. And John puts this really well here. I added the emphasis, legal risks aside, harm reduction is simply the right thing to do to keep students safe and well. This work has been ongoing and really important for a long time prior to this legal opinion being published. And our focus should always and is always on keeping students as safe as possible. And this opinion is hopefully just another tool to support the sector in understanding the importance of this work and committing to making progress. And that brings us to the end of that section. I'm going to go and just grab a drink quickly, because that was a very dense section. I'm super intrigued to see what the chat looks like when I close this share screen, and I'm really aware that we're going to run out of time for questions, so I'm going to move quickly here. That was a really dense section. This should feel hopefully light and breezy. We're moving back into just talking a little bit about the experiences that SOF have had of delivering some of this change on campus, rather than specifically being focused on that legal opinion discussed in the previous section. So one of our kind of key goals is always to make sure that you leave these sessions that we run with an idea of what you want to do next. We haven't today included a load of examples of best practice in terms of support, comms, activities, events, which we have done previously, but you're welcome to check in with us if you would like to have some of those examples. We're in the process of updating the case studies on our websites too, so you'll soon be able to kind of use that as a resource. But I've broken these down into individual and kind of organisational next steps. So firstly, I mean, there was a lot of people who said, they were unsure about their institution's approach. They weren't sure why they were here. I think it's great that you've shown up despite that. I think this is a really interesting area of work, and we need more people who are willing to have this conversation and to show up to things like this. So thank you for that. Have a look at the resources we send out. Think about how those things may relate to your institution or the work you do. For those who said they were more confident, become a champion for this work. Share what you've learned today and share what you learn from some of the resources and readings, and find others on your campus to join you in feeling that confident. And we also suggest that if you would like to network with other colleagues who are further along in the process, that's not necessarily on your campus, but there's a whole host of campuses who have been doing this work for a long time. So getting in touch with them and kind of understanding their journey can be really helpful. You can also contact us to chat with us about our experiences, or you can ask us to, maybe try and facilitate some of those conversations and networking as well. And then on this second slide, looking at you guys in your roles as part of an organisation, we would suggest considering that UUK guidance as best practice. The legal opinion supports that as well. And what would be a great starting point for some of those places who have yet to take much action here, and also those who are in the process of doing that or have done it but are not sure how they kind of map to the guidance, maybe mapping that work of the framework against the work on your campus to see where there may be gaps. We also recommend that higher education institutions and students' unions reach out to local organisations, start building relationships and support pathways for your students, but also get that expertise of your local area that you would get from local drug and alcohol services. That may be, young people's or adult services, depending on how the commissioning ages work there. But just see what's out there and start to build those relationships if they don't already exist. If they do already exist, look at strengthening them and deepening that understanding. And you can, of course, commit to understanding student behaviours and looking at what is happening on your campus. I mentioned our annual survey. What I don't think I mentioned is that we, if you get 100 responses, you get your individual data. So you are able to do that. And if you were interested in the first point here, that kind of mapping, We've worked with institutions in our drug and alcohol impact programme to basically support them to implement the framework. So we demonstrate that institutions have that commitment by doing that support piece for them. And the drug and alcohol impact programme has had people specifically sign up just to kind of fill that need, to meet that guidance. So those are some next steps for you. They're not super detailed, but we can always follow up. And I'm really aware we're running out of time. Just one quick Slido. There may actually be two quick Slidos, but we will see. I'm just going to let people fill this in. I'm going to see if I can actually find the chat whilst that's being filled in. So for those of you who haven't come across us before, we love trying to measure any sort of impact or engagement. So we always do a pre and post. On most of my webinars, I'm really confident that that understanding is going to go up. With the legal stuff today and it being very dense, I'm not so sure that I'm super confident, but I hope that it's at least been a helpful starting place for some of your thinking. Let's have a look. Oh, I'm also aware less people have filled it out, so that's 0% at not confident at all, maybe a fluke. We would normally ask you just what one action will you be taking to support students on campus, but we're really out of time, so I'm just going to bring up this last screen. My email address is there. You'll get an email from me, and also that QR code will take you to a short form where you can just sign up for some of our free resources for the survey for the awareness week, and also you can tick a box there for us to get in touch and like book a meeting to chat with you if you have more specific questions, because we're not able to do kind of institution specific stuff on this webinar. I'm going to just leave that up, but I'm really aware we've got a few minutes left. Is there, I mean, there may not be any questions anyway, but is there any questions that's come through, Fiona? Is there lots?
Yes, there are a couple. So we've got two. So I'll read out the first one. So the first one is around harm reduction work in relation to medical students. So kind of the fitness to practice that goes around that, and rules and how kind of the work that has been done around making sure that harm reduction can still be implemented within the student group.
Amazing. I mean, fitness to practice is one of the things that comes up really frequently. And I think that there sadly isn't a really good kind of national position on this at the moment. It was something that was considered in the Universities UK guidance, and it does make reference to that in the framework report from UK. So I would recommend starting there. There isn't a specific requirement to not provide information, advice and guidance to students on fitness to practice courses. The issue then comes with that kind of disciplinary route, and if students are using drugs, that kind of reporting. But there are, let me just stop sharing my screen quickly. Hopefully everybody has been able to share that scan that QR code, but we'll send the link as well. There are a lot of the institutions we work with on drug and alcohol impact who also have very large populations of students on fitness to practice courses, and they have navigated this from having kind of more specific conversations about the situations on their campus, what their policy will and won't include, and a harm reduction approach. Although we do talk about reducing some of that disciplinary impact, we don't talk about completely removing that in the current like UK legal framework, as well as fitness to practice and similar. There does need to be that disciplinary outcome sometimes, and fitness to practice fits into that. So they're not at odds with each other, but they haven't necessarily been smoothly aligned. We can absolutely do some more digging for you on that, if that would be helpful, if there's a specific body. Yeah.
Then there was one more. I know we're out of time, but there still seems to be a couple of people here. There was just one from Jeremy around kind of getting that very senior buy-in, so that kind of realization that a lot of standard facing or middle managers or even senior managers are very supportive harm reduction approach, but maybe kind of right at the top that's not always the case. So yeah, any advice you've got in relation to that with those that are happy to stick around for a couple more minutes?
Yeah, please, if people do need to leave, I'm really aware that this has run over. thank you for this question. I actually really enjoy this topic. I think getting that senior leadership buy-in is sadly sometimes really difficult, and it is, you know, essential for a lot of this work to have the impact that we hope it will. There are a number of things that you can do in response to this, and, you know, to provide that information directly to them. Firstly, the Universities UK report, as an example, is really helpful as a starting point. That, you know, they are that membership body for senior leadership and vice chancellors. So looking through that and understanding how those issues are framed would be a good place to start. If you have already done that, I'm sorry, getting distracted by comments in the chat. If you've already done that, this is where we hope that this legal opinion may also have the ability to have an impact. It lays out, you know, quite a lot of specifics in terms of where risk may be if you choose to do nothing. But I would also, one of the things we do in Drug and Alcohol Impact that I think is the most helpful for making progress on this is the university and students' unions working together. Jeremy, I'm not sure if you're in the SU or the uni, but I would look at engaging with the SU, looking at their student voice models, and seeing, you know, how that could maybe be supportive, and getting, yes, you're in the SU. I would absolutely recommend getting your kind of student leaders, your sabbatical officers involved in this, and having that conversation. But there is, yeah, there's a lot that can be done. I think maybe finding some of those less senior, but still quite senior allies in the university as well can be really helpful. So I'm not sure, I can't remember which institution you're from, but drop us a message afterwards, and let us know if you want to chat. We can maybe like strategize a little bit about how you pull that together. Maybe there's like a mental health and wellbeing board that this could be taken to. Yeah, and sadly that is the case in some situations. When I did my master's in drug and alcohol, comparative drug and alcohol studies, my dissertation looked at that policy change only happening as a result of a tragedy on campus, with a student dying. So, you know, we're hoping to avoid that. So you're not the only kind of person who's feeling like that. That is also sadly a consistent concern. But we are seeing movement. So I would say that legal opinion, getting some of that student voice, student pressure in there, and also, you know, the fear of being left behind, being the last people to do this, can also push that. Amazing. I'm aware we're over. If anybody else has any other questions, I'm happy to hang on for a few more minutes. But if people need to head off, please do. Yeah, brilliant example from the president at Huddersfield, I think, presenting a paper to senior leaders and having a harm reduction task and finish group set up as a result. Well done, that's brilliant. I love seeing sabbatical-led work. I think it's brilliant. If anybody has any other questions, or if